has actually gone down this week. So we're testing more. So if you look at the numbers, it looks like we have more cases, which we do, but that's because we're testing more people. But our rate of being positive has gone down from 9.5%, so almost 10% of people being tested being positive, and now it's down to 8.5%. So that's a good sign. We want as many people as possible to get tested, because then we know we're able to use that data to kind of understand what's going on, and we're able to study people. Okay, who's not getting symptoms at all, who's got mild symptoms, who's getting moderate, who's getting severe, so that we know how to treat this better. Also, because a lot of people are like, well, does it even make sense to get tested? But that's why we want everybody to get tested. And then they also will be utilizing that. The governor just had his, was on live not too long ago, and trying to be inventive with the way we use the testing. They're trying to get the rapid testing that can be done like very, very quickly, so that, say, people that want to see their loved ones in nursing homes, which are now banning any visitors because it's so dangerous to our elderly, that those people could potentially be able to be screened, get their answer within an hour, and be able to go in and see their loved one if they're negative and don't have a fever. So these are some positive ways that we can do the testing and use it as well. So that's exciting. Real quick, the numbers in our Central Florida area: Lake County's up to 233 cases, 57 hospitalized, and 13 deaths. There were 9 deaths last week, so we've had 4 deaths, and we did have in Lake County the first healthcare worker that succumbed to the COVID-19. Orange County's up to 1413 cases with positive cases, and with 246 hospitalized and 34 dead, up from 29. Seminole is 379 with 83 hospitalized and 8 dead. Sumter is 217. That's a huge jump of positive cases from 67 in Sumter last week. But Sumter County, as I've mentioned to you before, is a more elderly population, and they have really gotten in there, and they've really been testing a lot. And so that's why you're seeing more positive numbers. The good thing, though, is that only 41 were hospitalized, and there were 39 last week. So it's not like there's been a big increase. And the death rate in Sumter also hasn't gone up significantly. There were 12 deaths last week, and there's only been 14. So there have only been 2 more deaths in Sumter County. So that's a good thing. So even though the number of cases have gone up, as far as who's positive, the number of ill, the percentage is actually now better than it was. So what's happened this week, the big thing in Florida, of course, is that we are reopening come Monday. So what does that mean? Reopening at this point means that all of elective surgical procedures were all on hold. So now those procedures can be done in the hospitals. The offices for the physicians and for the dentist and any kind of a healthcare worker are now open without any restrictions starting on Monday. The restaurants are able to open back up. There will be 25% of capacity inside of the restaurant, and outside it's supposed to be about 25%, but it's more important that with all of this that they're maintaining at least the 6-foot social distancing, or like I like to call it, physical distancing. I don't like the word social distancing because that kind of has a negative connotation. The bars are still closed. The nail salons, unfortunately, ladies, and the hair salons and the barber shops are all still closed, which I think I said unfortunately, meaning just because all of us want to get back in there. But I do think that that's the safest way to reopen. The beaches are open. Yes, they are. And they're open without restrictions. But we are asking that people, no matter where you go, that you understand that if you want, a lot of people say, thank God, it's going to be so nice to get back to normal. But we have to have a new normal, okay? It can't be, if you think you're going to go right back to the way things were before this ever hit, like back into January or before, then we're going to run right back into another quarantine potentially, which is what's happening overseas in a couple of places where they let go of the restrictions, and then they had a huge surge of people becoming ill again. So we don't want that. We know that the COVID-19 is not going to disappear just because the governor said that we can start to resume normal activity. So the new norm has to be wearing a mask when you go out. It has to be going out because you really need to go out, not just because I'm going to go back to business as usual. It is maintaining your physical distance. because the disease is still going to be out there. And as you know, I don't recommend that you wear gloves. I don't think that that's a good idea. I think that it gives them a false sense of safety, and you actually end up probably increasing your risk for contaminating yourself versus decreasing your risk. As far as my office, we've always been open on Tuesdays and Wednesdays. We will probably add another day open based on patients' desire. We've been doing telehealth the other 3 days, and that's become extremely popular. And we also can accept new patients both by telehealth and in the office. So that kind of updates all of that fun stuff. And now what I'd like to do is bring on, like I said, Dr. Evans, and let him kind of talk to us a little bit more. If you have anything to add to anything I just said, you feel free to. If not, what I wanted to do is, like I said, kind of talk about what's going on in the hospitals.
Hello, and thank you so much for inviting me on, Dr. Glover. This is a great opportunity to talk, get some information out to the general public of what's going on in the hospital. As we know, that 19 has transformed the hospital systems in the way we deal with patients, both COVID patients and non-COVID patients at this point in time. I had the privilege of helping to organize the change and the response to what we assumed was going to be a large surge, based on what we saw in other areas, particularly New York and Seattle areas. Luckily or blissfully, we are not experiencing that type of surge, but we still are ready. So the first thing I want to express to everyone is your hospitals in Central Florida and all of Florida are safe. They're safe places. We have done so much work in preparation and separating and having tracks for patients who are positive, potentially positive, and non-positive patients. And even now, we're actually moving towards a posture of testing everyone. The biggest thing that we could do was we actually started testing at a rapid rate throughout the country. That was a big thing, because now we're able to see whether someone is positive or not in a very quick and very rapid response. Some tests are in less than a day, and most tests now are within 24 hours. Why is that important? Is because as we move now towards a posture of reopening our cities and reopening our hospitals to elective surgical procedure or elective care in general, if we decide to, and when we decide to test everyone, these results are coming back quickly. We know they're negative, or if they're positive, yes, we're still treating them, but we know what track to send them down. So this, as Dr. Glover said, is going to be a new norm, whether it be outside the hospital, in the communities, or inside the hospital. The hospitals are being re-engineered in such a way that we will structure towards all types of respiratory viruses and illnesses, just to make sure that something like this doesn't stop the entire industry or an entire economy the way it did before. So specifically to the hospital systems, what we are seeing, and this is what concerns me most, what we're seeing is that people are staying home, and which is good when you're not sick. But when you're sick, you need to come to the hospital. What are the unfortunate results of what COVID-19 has done for us is that it scared people so much into staying away from hospitals that when they finally do come in, they're really sick. Our acuity, which when we say acuity means how sick you are, how sick the people are, the individuals are coming inside the hospital, is very high. And so we don't want you to stay away thinking that you're going to get a disease when you come to the hospital. You're not. As I said, the hospitals are safe places. We've structured so well all the hospitals across Central Florida, whether it be Advent Health, My Hospital Central Florida Regional, or HCA facilities, or Orlando Health. All the hospital systems have structured in such a way that they will protect you. So please make your way to the hospital. Inside the Sanford Hospital specifically, we have not seen a very high rate of positive individuals. Right now, I believe we only have 2 positive individuals currently, and none of them are on the ventilator. One was on the ventilator. We were able to use something called convalescent plasma, which we can speak about if anyone wants to. But basically, is the plasma that comes from someone who was positive, who actually successfully beat the disease, and now they give their blood, and we give it those antibodies, those things that fight the virus, back to the individual who's sick, goes into their body and is able to encapsulate and stop the virus. So we're able to do that in one of our patients. I know that downtown in Orlando Health, they've done at least 28 or 29 individuals who've all done well. And we at our hospital have not seen any deaths. However, I know that downtown there have been a few. So that's the situation there. Now we're testing almost, anytime someone has any suspicion for it, we're testing. And as we go into the next week, we'll probably be testing all individuals that come into the hospital, because now testing is really something that's ubiquitous.
Thank you. And I think that, like I said, the other thing that people need to understand is not only come to the emergency room, because that's what's happened, and they're seeing the same thing in New York. They're like, suddenly, where are all the stroke patients? Where are all the people having heart attacks and strokes and all, appendix ruptures and all these things that we know occur? And so there are people that are toughing it out at home, and then they're increasing the risk of a much worse outcome and or death from something non-COVID related
Lethal.
that
Yes.
would normally have been treated versus something that's, that they would have had treated much faster, sooner. So we want to make sure that people understand that, especially we're lucky here in Central Florida that we have the what you hear, the PPE, we have the protective equipment, so our doctors and nurses and healthcare workers do have what they need to protect themselves, which is a blessing. It's a huge blessing, and to protect you. And that the hospital has always had what we call universal precautions in place. So this is not something new. If you've stayed in the hospital any time in several years, you notice that, we've always put stress on hand washing. We have always had disinfectant at the doors of every single patient room, and it's a requirement that you use it going in and out and wash your hands, coming in and out, has always been the recommendation. So that's not new for us.
Right.
So, and for us, for healthcare professionals, once again, we have practiced that way, and we practice that way in our offices too. Now we are even more diligent now, but it's not. So it's not something where you have to think that the hospital is trying to learn something brand new that they've never done before. Wouldn't you agree?
Correct.
The other thing is, with surgeries and ultrasounds and all the things that people go to the hospital for. Yes, we don't want you going to the emergency room just because. I've never wanted you to go to the emergency room just because. It drives me crazy when they didn't like me in the emergency room when I was training, because I was very sticklerish about people being there for non-emergency reasons. And so I would make it very clear to them that that was not the way the emergency room should be used. So it's not there for stuffy noses. It's not there to refill your medicines, or because you just didn't want to go to work that day and you need a doctor's excuse. So don't go to the emergency room if it's not a true emergency, but please do if it is. But for the surgeries, it's a whole different wing of the hospital. So, and for the radiology department, once again, the laboratory, all of those things are completely different. If all of the hospitals right now that have COVID patients have COVID wards, meaning those patients, if they test positive, or if they're what we call a rule out COVID, where they're having symptoms but they haven't been tested yet, they're going into a special area of the hospital. So it's not like there's just COVID patients loose through the hospital or something like that, so that you guys can feel safe about going back to getting your procedures done. Would you agree with that, Dr. Evans?
Absolutely. You can definitely feel safe. They're not in an area where the general population is. And that's why we're starting to test the general population, because of just that. We want to make sure that everyone feels safe, and we know that anyone that's coming in, we won't miss anyone that happens to be positive.